And a lot has changed over the course of a month. Just as rapidly as we saw that increase in cases, we've seen a decline in cases, similar to the experience of hospitals and health systems throughout the country. And so that's good news. This Omicron surge really was like a flash flood. And as quickly as it came up on us, it seems to be receding. And so that is welcome news. And over the course of the past 4 weeks, we've seen a steep decline in our number of inpatients. We still have, relative to the history of the pandemic, 48 inpatients between Mary Washington Hospital and Stafford Hospital. That's a large amount as you look down that timeline. There's only really a few other points in time in the past 2 years where we've had that many inpatients, but really we're not at that crisis level of approximately a month ago where we had about 200 inpatients. And so that has caused a lot of relief in our system. And I'm happy to report to everybody that we are back to really care as usual. And I encourage everybody that we are staffed and safe, and you can receive high quality care with confidence at Mary Washington Hospital and Stafford Hospital. We are here for you, as our tagline would say. And so I also would like to note, it's one of the reasons why we're having this town hall and bringing everybody up to speed is we have seen a few patients come in recently with relatively more severe disease because they have delayed care slightly. And so I just encourage everybody, if you have healthcare needs that need to be addressed, don't delay care at this point in time. It is safe to come receive your care so that you can have a better health outcome. Okay, and that's really the message that I think Chris and I want to deliver to our community today is we have seen a steep decline in our inpatient hospitalized COVID patients, and that has allowed us to decompress as a health system and return to normal. And that is fantastic news. One of the other graphics we like to share with our community is our current COVID inpatients and their vaccination status. The yellow figures on the graph have always been those patients who have not received a COVID vaccine. The blue figures are those who are fully vaccinated, and the green figures, those up to date with a booster. And we do have some boosted patients that are hospitalized, largely those patients who are immunocompromised and cannot mount the appropriate immune response even to the vaccine. They've always been very highly susceptible throughout this pandemic. It's one of the reasons why all of us take extra precautions in the community to help protect those individuals that can't mount that immune response themselves. They need special protection. One thing in this graphic, and it's shown that we've shared these graphics several times a week, really, throughout the pandemic and through the Omicron surges. There's always a lot more yellow figures on the graphic than the other colors. And that's in stark contrast to the vaccination rates in the state of Virginia. I don't know if everybody's aware, but over 92% of adults 18 and older in Virginia have received at least one dose of the vaccine. About 82% of adults 18 and older are fully vaccinated. And so the graphics have never showed that there's disproportionate the impact that the unvaccinated have had and the hospitalization requirements for the unvaccinated. So I still encourage everybody in the community, if you've not been vaccinated, please get vaccinated. If you know friends or loved ones who are not vaccinated, encourage them to still get vaccinated. Booster penetration in the state of Virginia for those eligible is only in the 30% range. So a lot of adults who have been fully vaccinated have not taken advantage of the boosters, which we know have given some extra protection, especially during this Omicron surge. So again, if you are fully vaccinated but not boosted, I encourage everybody to get boosted as well to protect yourself.